When people hear veterinary doctor, what comes to mind is pets, dogs, cats, and sometimes cattle, and vaccination. But there's a whole side of this profession that directly affects and impacts the food that we eat every single day. And that's what we're delving into on Successory Business Lounge today. Let's get into it. Thanks for joining us on another exciting episode of Successory Business Lounge, where we bring entrepreneurs to share their success stories and we bring stakeholders to discuss business policies, how it affects every Nigerian entrepreneur, businesses, and also we talk business without the jargons. So today we'll be diving into this conversation that connects us from what happens on the farm to what ends up on our plate. I am joined by a veterinary expert who is Dr. Bala Muhammed. He will be helping us break this down in a way that is practical, eye-opening, and relevant to everyday life. So it's good to have you on the program.
Thank you very much for having me. I am Dr. Abubakar Bala Muhammed. People call me Dr. Bala. I am a veterinary surgeon. I'm also a public health scientist, but most importantly, I am an entrepreneur. I run a series of businesses across Nigeria and Africa.
Wow, that's interesting to know. So when people hear veterinary doctor, they think pets, but your work affects other areas like food security, policies, and the like. Can you enlighten us?
So food safe vets naturally in our climb here in Nigeria, it is actually been associated with pet medicine and pet animal medicine. It's also very alien to us because apart from using dogs and cats to hunt down for hunting and use them to control rats, whatever, it's not as popular as it should be in the West. We also want to expand it by saying vet doctors will always do all they can in making sure that the milk, the egg, the meat, and other products that we eat from these animals are healthy, are safe, no risk of diseases to the human.
Okay, so that takes me to my next question. How exactly does animal health connect to what we eat on the table?
That is public health, that is food safety. And as these days, from some of the things that we learn in Successory Business School, it is important that people know that from farm to fork, you have to be wary of what you consume. There is this popular saying that you are what you eat, and the food that we consume, like I said earlier, eggs, meat, milk, and some other byproducts that we always don't mention here, are laden with public health risks. In other words, they contain diseases and will have to be processed in a way that those diseases are exempted so that we don't get sick after eating them. And I will mention 3 examples. For instance, when we talk about colibacillosis, we talk about E. coli. These are diseases that have caused severe sepsis in children, in pregnant women, in the aged, that is our seniors, but also in the larger population of a human population. And where will they get it? From eggs that are soiled with feces of animals. And then the moment they are not properly sanitized before even breaking the shell and then produced and then passed for human consumption, automatically we get the disease-causing organisms called E. coli, and we become sick. And the doctors are battling. Of course, the human doctors know the origin of E. coli, That is just one out of so many. But you also have issues with what we call tuberculosis. I don't know if you know tuberculosis. More than 70% cases of human tuberculosis are from bovine. When we say bovine, cattle. So today, and I'm very sure we have our staff in the abattoir who help in inspecting this meat and certifying them for human consumption. About an hour ago, I got a call that we have to send police out there because the processors had actually, my supervisors, veterinary supervisors, identified cattle with tuberculosis, and the owners of the animals are trying to pass them. Now, for the vigilance of these veterinary doctors, it would have gone through and been passed to human food chain, and naturally unsuspecting consumer will take them, and that is how we contract tuberculosis.
There's the myth that when we process these foods, like cooking them, or when it goes under fire, it kills all these organisms and it makes it healthy. How true is that?
Well, it's very correct to some extent, but there are other organisms that come alive when you cook them.
Wow, they come alive when you cook.
Yeah. So when they are not cooked, they are not going to do you anything. Unfortunately for us, this part of the world, we don't like cooking like the Europeans, where you have slices of fish, tunas, and meat not cooked. So I don't want to bug you with the long technical names, but the standard thing in food safety is that they must be subjected to the two extreme temperatures, so that these two categories of organisms, disease-causing germs, will be properly sanitized. Will be destroyed and sanitized. And what is the process? Once an animal is slaughtered, it should be blast frozen with the blood. Immediately blast frozen, taken into the fridge, and in less than 1 hour is stone cold. Really blocked. And then once you do that, then we can now take them out of our freezers, detour them, and then you can now boil. So that way they've been subjected, and then these two categories of disease-causing organisms would have been destroyed and will be safe for human consumption.
So can you tell us, what does it really mean when you say a healthy animal? What does it really entail?
So it's a lot of things, because even recently, there was a report, I think from, is it Taraba or Adamawa State, where some animals ate poisonous plants and died, and people were feasting on it, and those who ate part of the intestine also came down sick. So when you say healthy animal, it has a lot of things to do, from physical stress to infectious diseases process, to having some animals that may not be palatable. And I think quickly I want to state here, when you get very old animals, spent animals like cattle, they may not be sick, in quote, like suffering from an infectious disease process, but because the meat is no longer palatable to nourish the consumer, the human consumer, it is considered not healthy for human consumption. In other words, you are busy, chewing flesh, but the actual nutrient that you are supposed to get consuming, it's no longer there, so it's not safe. or you have an animal that just went out healthy, grazed, inhaled poisonous, grazed on a poisonous plant, inhale toxic
Emissions,
from fumes, or you also have them being knocked down by cars. There are stress hormones that once an animal is involved in an accident, that is being released, and it interrupts with the health formations of the kind of nutrient that we get from them, and therefore those ones are not considered healthy. Another context is that every country has gotten a list of animals considered to be food animals. If you have, for instance, in Nigeria, you list animals like ruminants, which is cattle, sheep, and goat. They didn't list buffalo. They didn't list some of the wild animals like gazelles and whatever, like deers. You also have other animals, large animals like donkeys and horses. They are not listed. Once you have those ones being processed for human consumption, they are no longer considered healthy for human consumption. No matter how physically or how tasty they are, the system, the policy, the regulation does not permit that we take them in for human consumption. And quickly adding to that, that is how Ebola was introduced. That is how SARS-CoV was introduced from wet markets in China. That is how SARS-CoV-19 was also being found to be causing havoc, and the lists are endless. So you don't go, because bat had been found by certain communities to be very good delicacy, that start indulging. The authorities who certify them fit had said no to bat as birds or mammals to be consumed as human, so they are not healthy for human consumption. That is the broad definition of healthy animal.
So, are there common mistakes that farmers and handlers of animals make that people don't realize that are risky, but it's risky when it comes to animal health?
And in veterinary and human medicine, there is an area we call biosafety. There is also an area, in fact, it's an area of specialty where we talk about biosafety and biosecurity. And when you say biosafety, is to see how you protect yourself as an animal worker, as a farmer. You protect yourself perhaps from infection that animals will pass to you by mere association, by close association, by also having to consume part of them, not as stipulated. But we've also gotten the biosecurity, which farmers make a lot of mistakes. And biosecurity is simply having to exclude disease-causing organisms in the farm, in the flock of animals, birds, or a herd of animals, so that you don't brew and get your animals infected and also be passed to humans. Now, most of these mistakes are what I will consider the intersection where veterinary services are actually required. Remember that the veterinary doctors are also humans, and whatever will affect the larger public health will start first with the farmers and the veterinary doctors that are working closely on the farm with these animals. And some of those mistakes are when you produce large animals and you use antibiotics indiscriminately.
Can you give us examples?
Poultry, pigs, and dairy producers believed when you actually feed the animals with certain antibiotics, they grow big, which is true. But that has been found to be a major driver of antibiotics. Why those who will later consume these animals, human population that will later consume these animals, will no longer respond to antibiotic treatment.
Wow.
And it's a very huge one. There's going to be a conference in Abuja by the world in the next 1-2 months, because it's considered a major problem in our climate, in developing economy. People buy tons of antibiotics to add to the feed of the animal so that they can get more milk, more eggs, and bigger meat. And it's a mistake that we should not be making, because it's responsible for the new pandemic that is upon us. Secondly, you also have this mistake being made by farmers, vets, and para-vets alike, where the use of disinfectant, putting on like PPEs, when the gloves, the lab coat is being considered as a fashion thing, and therefore since I'm gonna get dirty, let me just wear any rag, and then they get into the using those rags that are not well sanitized. You get into the animals, you pick up some infection, you didn't clean it, and you take it back home to your families. You've broken the biosecurity. The animals you keep, which are always in thousands and in millions of naira, will be exposed to diseases because you didn't keep to wearing clean. It's not only that it is clean, they are supposed to be disease free, and that is why each day you use them for any procedure, they are supposed to go into cleaning. Unfortunately, we don't do this. We don't think those diseases are able to. And then lastly, where workers around animals, it's a mistake. It's a myth, but it's also a very big mistake on the side of practitioners, veterinary doctors, veterinary paraprofessionals, and farmers, where when you get exposed to this, you will contract those diseases, and they think they are superhumans. Oh, we've seen so many and nothing happened. It's not true. It's a very big mistake. People live, they are sick, before you know what is happening, they are dead, and the process may not be good enough to underpin what is responsible for their death.
So you can continue.
So
when someone dies.
So it has actually been responsible for so many deaths in the human population, and we don't have this culture even in our public health, where you do what is called in epidemiology, we do a trace back. For anyone that dies, even if it is a day old, stillborn, it is important that the authorities understand why that baby should come dead, let alone a living adult who works in a facility like farms and laboratory and what have you. It would be very nice to trace the cause of death, so that you are able to establish and prevent the larger population from it happening in the next time.
Another thing I want to ask, some of these organisms that these handlers or farmers pick from the animals, are they asymptomatic? Like, are they organisms that will react immediately? Or because, like you rightly say, sometimes because they don't see any reaction, they take it for granted. So are these organisms asymptomatic too? As in asymptomatic, so that's why they take it for granted?
Yeah. So you actually are using the right word. I didn't know that you are a doctor too. So there are so many organisms responsible for diseases outbreak. Things like COVID, things like Ebola, things like SARS-CoV-3, things like bacteria infection, like tuberculosis, diarrheas are even conditioned. But they use human being for the first time as what we call fermentation vat. They are viral, they get into the human, and then you just start feeling unusual signs, different from those malaria, stomach pain, diarrhea, signs that we put up to say, oh, you have typhoid, or you have this headache, it's malaria, or malaria fever, typhoid fever, or the common infection. And what these organisms do, since they've not been used to human host, so they get in there, they change their morphology,
Mutate.
correct, and then they now bounce into the population and become something we've never seen. So back in the hospital will have to do a lot of work, identify it, characterize it, know how they can go forward in terms of incident management and control. And that is why you see a lot of people take it for granted, because people just lazy around. It speaks, and then when they go to the hospital, they are able to pick, oh, he has malaria, oh, he has typhoid fever, and then they treat the malaria, treat the typhoid fever, or treat those common things, and then leave this to allow it time properly launch itself.
Faster.
If care is not taken, that you have a proper disease diagnostic system, it consumes that person and is likely to transmit it to family members, to colleagues at work, and it keeps going on and on that way.
You said something earlier that really piqued my interest, and you said if animals like go around or poisonous plants.
Yes.
Now, how can handlers, farmers know poisonous plants, or even people that have pets?
So it's a very strange thing in developing economies where you just graze your animals in the wild. I mean, you just freely graze your animals. It's strange to husbandry system, and that is the only time that you found those kind of accidents. Otherwise, in a proper farm where you release the animal to graze, those grazing lands are properly, clean and treated, to the extent that the farmers know those poisonous plants, and then once they start sprouting, they know that with the sap, they have certain kind of juice. This is a poisonous plant, and then they find a way of destroying it from the root, and the animals never get access to it. But when you do free grazing, like what we do from one state to the other, one region to the other, you are very likely going to stumble on some syrups, some plants that are toxin producing and will always kill the animal, and to the extent that whatever they consume if humans also have access to it, could be very fatal in public health.